If you've ever mixed up C5 and T1 or forgotten what the musculocutaneous nerve actually does, this video is for you. Today, we are doing 10 real Harvard exam questions and answers. The topic is brachial plexus. You know, Harvard doesn't just ask, name the nerves. They test if you actually understand the function, injury, and clinical picture. Here is how we'll move. We'll start simple with roots and trunks. Then go to divisions, chord, and terminal branches. Each question builds on the last question. So by the end of this video, you'll be able to reconstruct the whole plexus, the whole brachial plexus in your head and nail any clinical case. So you are free to pause the video, try to answer it first, then I'll give you the answer and the why behind each answer. Let's begin with the first question. What are the spinal cord segments that form the brachial plexus? The answer: the brachial plexus is formed by the ventral rami of C5 to T1. Sometimes C4 contributes and T2 gives a small contribution. Why it matters? If you know the roots, you can predict which muscles are affected in any level of injury. Question 2. Name the 5 parts of the brachial plexus in order from proximal to distal. The answer: we have the roots, trunks, divisions, chords, and branches. To help you remember, here is a memory trick. Radical techies drink cold beer. R for roots, T for trunks, D for divisions, C for chords, and then B for branches. Quick question: where does Ebb's palsy occur? The answer: in the upper trunk injury, C5 to C6. Now the third question: a patient cannot abduct their shoulder beyond 15 degrees. Which nerve is likely injured and what is the mechanism? The answer is the axillary nerve injury. This nerve innervates the deltoid and the teres minor muscles. Axillary nerve is commonly injured in shoulder dislocation or crunch palsy. Key point to remember: loss of shoulder abduction 15 to 90 degrees is deltoid loss. Above 90 degrees is supraspinatus, which is supplied by the suprascapular nerve. Question 4. What is the Klumpke's palsy and which roots are involved? The answer: Klumpke's palsy is a rare form of brachial plexus injury that causes weakness or paralysis in the forearm, the wrist, and the end. It is also caused by the damage to the lower network of nerves connecting the spinal cord to the arm. The roots involved are C8 to T1. It causes a claw hand. Yes, claw hand with loss of intrinsic hand muscles Also loss of sensation on the medial forearm and the hand. Question 5. The musculocutaneous nerve is a branch of which cord? What does it supply? The answer? It is the branch of the lateral cord. It supplies biceps brachii, brachialis, and the coracobrachialis. This nerve becomes the lateral cutaneous nerve of the forearm. Sometimes during DR exam, people do confuse musculocutaneous nerve to median nerve, especially at the level of the elbow. So keep in mind this exam trap. Question number 6. A patient has wrist drop and cannot extend the fingers. What nerve and which part of the plexus is involved? The answer, the radial nerve is involved. Radial nerve injury, usually at the level of the spiral groove, causes the wrist to drop. This radial nerve comes from the posterior cord and supplies all extensors of the forearm and the wrist. Question 7. What is the anatomical significance of the posterior cord? The answer? The posterior cord gives rise to the axillary nerve and also the radial nerves. All the branches of the posterior cord carry posterior division fibers. So the posterior cord supplies the extensor muscles and the posterior part of the skin. Quick question. Which cord is purely posterior division? The answer? It's the posterior cord. Question number 8. Which nerve innervates the thenar eminence? And what is its root value? The answer is the median nerve. The root value, C8 to T1. Did you know? Carpal tunnel syndrome affects the median nerve, causing muscle weakness, weakness of thumb opposition, and up hand deformity in severe cases. Question number 9. A patient presents with a winged scapula. Which nerve is damaged and where does it arise from? The long thoracic nerve is damaged. It arises from the C5 to C7 and it innervates the serratus anterior muscle. This nerve, the long thoracic nerve, comes directly from root and not from a trunk or from a cord. It comes directly from the root. Question number 10. You see loss of sensation over the lateral 3.5 fingers and palm. What nerve is affected? And what functional test would you do? The answer? The median nerve is affected. The functional test to carry is the thumb opposition and also sensation over the thumb, index, middle, and lateral half of the ring finger. Have you seen? Harvard loves to combine sensory and motor testing in just one question. Now, out of 10, how many did you get correct? How many have you scored? Write it down in the comments below. And yes, if you got 7 out of 10, you are in a good spot. The brachial plexus only makes sense when you link up the structure, its function, and also the injury. If this video has helped you, don't forget to like and also to subscribe to this channel. In the next video, we are going to talk about cranial nerves. Yes, we will have 10 Harvard real questions and answers. So, see you there.